Good afternoon. My name is Ann Woodbury. I am the Managing Director of the Washington, D.C. office of Togo Run. We are a small boutique healthcare communications agency and specialize in public relations and public affairs. You'll be hearing from Aaron Enke, who is a Vice President at Togo Run, about some of the work that we've done in the space of public health and digital. First, just wanted to welcome all of you here and thank you for coming. I really want to take just a moment and thank Susanna Fox and the Pew Research Center for hosting us here and allowing us to have this event, which I know is going to be, I've seen the slides and I can tell you is going to be really interesting information. And certainly all our panelists, particularly on the Pew Research Center, I just want to thank Cornelia Carter Sykes and James Hawkins for all the help that they've given in setting this event up. And I also want to give a shout out, although I don't see her right now. Oh, there she is. Hi. To Deb Maggart on our team, who has really been the force in putting this whole event together. I think that it's going to be a great event, and I just want to also take a minute for some housekeeping things. That if you need Wi-Fi, you'll see some signs around here that the Wi-Fi service PRC guest, and the login is on the piece of paper there. And also the hashtag is digital health. If you want to tweet comments or questions, we are going to have some time here where people are doing presentations, but there will be ample time for questions at the end. And so we have folks that are monitoring that, and we'll be able to help feed the questions. But in addition, there'll be time for you to ask questions in person as well. So with that, I think I'll hand it over to Dr. Val, who will be moderating for us.
Well, I'm really excited to be here. I'm a physician, obviously, as you may have guessed from my name. I used to work at Revolution Health. I was their senior medical director there for a number of years, and that's sort of where I got introduced to social media. And through some pretty pivotal personal experiences, I realized that that social media can change lives and save lives. And so before I introduce our distinguished panelists, I thought I would give you a couple of anecdotes just from a medical perspective on why I think this is so important to public health and personal health. You know, at Revolution Health, I rounded up a group of experts in different fields to blog about the latest research in their field. So, for example, we had one blogger who was a specialist in colon cancer. He was a GI oncologist at USC, and he would write very engaging blog posts about some of the exciting advances in colon cancer therapeutics, where, you know, at one point, stage 4 colon cancer was terminal, but now actually it can be cured sometimes. So he was just writing about things that he discovered in his lab and some of the new treatments. And I'll never forget the day when I got an email from a patient who actually was told by an oncologist somewhere in the Midwest that, that she was going to die. He had diagnosed her with stage 4 colon cancer. And obviously that was just devastating news for her, and she was terrified. She went online to see if maybe there was hope, if there was anything that her doctor might have missed, if there was something else that she could glean. And she happened upon Dr. Lenz's blog at Revolution Health and realized through reading his posts that, yeah, maybe 5 years ago, stage 4 colon cancer was usually terminal, but now it could be cured. And so through reading his posts, she actually changed doctors. She went to an academic center, and she was cured. And that happened through a blog. So that really touched me, and I thought that was incredibly powerful. From a public health perspective, I think that online communities can be incredibly influential in people's behavior. You know, it's really challenging to change behavior. We know that the obesity epidemic in this country it does not seem to be taking the right turn from a curve perspective on a data point graph. And I actually had the opportunity to lead a group called Lose 20 Pounds with Dr. Val. And it was a lot of fun. You know, having a healthcare professional available to answer questions when there were medical questions was helpful, but also the fact that we could all just sort of get pedometers and check in with each other. We had people, who were participating from North Dakota, and they would say things like, I don't have a peer group that I can go walk around the neighborhood with. I live on a farm in rural North Dakota, and I'm overweight and I'm really struggling, and I know that you guys are there for me. And, she bought a pedometer and wore it, and she'd report in about how many steps she'd taken that day. And, she just felt like she was very much supported in her activities. And so we had thousands and thousands of people across the country and even in other countries who were working to lose weight together in the online group. And I thought that was really powerful and exciting. So I became a big believer in the importance of different social media platforms and their ability to influence people's health and even save lives. So I'm excited to be here as your moderator, and I'm going to try to make sure that the flow is nice and smooth. And so with that, I'm going to read some social media friendly personal type introductions to our panelists. And as I read their introduction, if they could bravely come towards the stage and sit in the front, that would be fabulous. So our first one is going to be Susanna Fox. Susanna obviously works for the Pew Research Center's Internet and American Life Project, which studies the social impact of the Internet. The best way to explain it is to say that Susanna is an Internet geologist. She measures patterns in the Internet landscape. And here's a very important distinction. A geologist does not judge the rocks. She studies them. Susanna doesn't say one technology is better than the other. She doesn't say and one outcome is better than the other. She provides data to help you make those judgments for yourself. Susanna is the former editor of the website for U.S. News and World Report, winner of the 2001 National Magazine Award for General Excellence in New Media. She's also worked as a researcher for Real Networks and for the Harvard Group. She graduated from Wesleyan University with a degree in anthropology. Welcome, Susanna.
Thanks.
Next, we have Maya Linson. Maya is the communications specialist and web content coordinator for the National Association of Public Hospitals and Health Systems. She hails from Southern California and often says dude and rad. She says that she left beautiful California because she desperately wanted to live without a car. 5 years later, she is living her carless dream here in D.C. Maya holds an MS in journalism from Northwestern and a certification from the Kellogg School of Management in Media Business Management. Her thesis project was related to social media and nonprofit organizations. Though her professional background is in health, she is very interested in environmental preservation, and her friends say that she has a special affinity for elephants. And we have Erin Enke, also known as Erin Enke Hadley. Erin Enke is Vice President and Manager of Digital Communications at Togo Run. She sometimes prefers to be introduced by her hyphenated last name so that her husband doesn't feel left out. She has over 10 years of experience in the healthcare and digital communications arena. Erin specializes in creating online strategies and new media campaigns for healthcare clients. Her work takes advantage of her experience in digital strategic planning, online mapping, issues research and analysis, and persuasive writing. Erin has unique U.S. and global digital expertise with experience in developing digital news hubs, online press kits, optimized new media press releases, online key influencer media lists, and unbranded websites and strategies for appropriately using new media. Erin is the proud mom of a beautiful one-year-old daughter. And so each of our panelists is going to give us an approximately 15-minute presentation, and then we're going to have 30 minutes for audience Q&A. And we're also going to be joined by a large cohort of followers on Twitter. So they'll be able to ask their questions in real time. So those of you who are tweeting, please do an excellent job so they know what we're talking about and will be able to formulate some relevant questions for us. And we will begin now with Susanna. So thank you very much.
Thank you.